Hello students and friends. Welcome to Homeopathy Medicines. Today in this homeopathic Materia Medica lesson, I will discuss about homeopathic medicine Muriaticum acidum. Before starting this video, please subscribe to this channel for Learn Homeopathy Online Free and Homeopathy Materia Medica. We need support from you to make this channel more beautiful and more informative. Now going to discuss about Muriaticum acidum, its uses and symptoms. This acid has an elective affinity for the blood, producing a septic condition similar to that found in low fevers with high temperature and great prostration. Patient becomes so weak she slides down the bed. Decomposition of fluids. Involuntary stools while passing urine. Hemorrhages. Mouth and anus chiefly affected. Mind, irritable and peevish, fretful loud moaning. Great restlessness. Sad, taciturn, suffers in silence. Head, vertigo, worse lying on right side, occiput heavy as if filled with lead. Sound of voice is intolerable. Pain as if brain were crushed. Nose, hemorrhage, much sneezing. Face, lower jaw fallen, pimples and freckles, lips raw, dry, cracked. Mouth, tongue, pale, swollen, dry, leathery, paralyzed. Deep ulcers on tongue. Hard lumps in tongue. Epithelioma, edges bluish red, carbolaceae. Aphthous mouth. Gums and glands swollen. Fetid breath. Swords on teeth. Throat, uvula swollen. Ulcers and false membrane. Adematous, dark, raw. Attempted swallowing produces spasm and choking. Stomach, cannot bear sight or thought of meat. At times, ravenous appetite and constant desire to drink. Achlorhydria and fermentation of food. Rectum, tendency to involuntary evacuations while urinating. Hemorrhoids most sensitive to all touch, even sheet of toilet paper is painful. Anal itching and prolapsus anti while urinating. Hemorrhoids during pregnancy, bluish, hot with violent stitches. Heart, pulse rapid, feeble, and small. Intermits every third beat. Urine, cannot urinate without having bowels move at same time. Female, menses appear too soon. Leukorrhea. During menses, soreness of anus. Ulcer in genitals. Extremities, heavy, painful, and weak. Tottering gait. Pain in tendo Achilles. Skin, papular and vesicular eruptions, with great itching, rheus. Carbuncles, foul-smelling ulcers on lower extremities. Scarlet fever, livid, with pedicai, scandy eruption. Eczema on back of hands. Fever, cold extremities. Heat without thirst. Typhoid types, stupid. Hemorrhages. Restlessness. Involuntary discharges. Bed sores. Pulse rapid and feeble. Excessive prostration. Modalities, worse, in damp weather, before midnight. Better, lying on left side. When treating a low form of continued fever with extreme prostration, arsenicum, muriatic acid and foes. Acid force themselves upon the mind. With arsenicum there has been the anxious restlessness, with foes. Acid there has been the mental prostration, and then the muscular weakness. With muriatic acid the muscular weakness comes first, and there has been history of restlessness and the mind has been stronger than could be expected. With this great muscular exhaustion with jaw hanging down and the patient sliding down in bed and soon the involuntary stool and urine, this remedy is forced upon the mind. Paralytic weakness is what it must be called. Soon the tongue is paralyzed, as well as the sphincters of the bladder and rectum. It seems to be eminently fitted for the lowest forms of zymotic fever when the above symptoms are present. He finally becomes unconscious. There has been some restlessness, but nothing like arsenicum and rustox. He refuses to talk because it frets him to do so. Foes. Acid is slow answering questions because of exhaustion of mind which makes him unable to think. The vertigo comes on moving eyes, and on lying on the right side. This vertigo is sometimes associated with liver disease. A stout, full-blooded jaundiced man about 40 had suffered much from pain in the liver, with great soreness, was comfortable only when lying on left side, When he turned on his back or right side, an anxious vertigo would come at once and he would break out in copious sweat, and be forced back to the left side. Muriatic acid made a complete cure of this liver trouble, which had been pronounced serious. The headache is aggravated moving the eyes and rising up in bed, ameliorated by walking about slowly. Occipital headache with dim vision, aggravated by effort to see. Heaviness in occiput. Numbness in forehead. Soreness in occiput. Feeling as if hair were standing on end. Heat in top of head. Perpendicular half sight. The eye symptoms ameliorated in the dark. Stitching pain. Burning, extending left to right eye, ameliorated washing. Itching in the eyes. Hardness of hearing, loud crackling sounds during the night. The sound of voices unbearable. Buzzing in the ears. The nose is stopped. Nosebleed and whooping cough, in zymotic fevers, in diphtheria and scarlet fever. Dark putrid blood from nose. The lower jaw hangs down in typhoid fever. Margin of lips dry, sore and cracked. Burning lips. Mouth and tongue coated white. Sores on the teeth. Gums swollen and bleeding. Teeth become loose. Tongue dry, heavy, stiff and paralyzed. Mouth dry. Ulceration of mouth and tongue. Red tongue. Blueness of the tongue. Mucous membrane of lips denuded. Sore mouth of nursing infants. Mouth studded with ulcers. Deep ulcers with black base. Violent inflammation of the throat. Dryness of the throat. Dark red throat with ulcers. Grayish-white exudations. White exudations resembling diphtheria. Gangrenous sore throat. Hawk's-out fetid mucus. Diphtheria with extreme prostration. Gray thirst. Thirst during chill and thirstless during the fever. Aversion to meat. Crave stimulants. Eructation bitter and putrid. Spasmodic action of esophagus. Vomiting sour. Involuntary swallowing. Emptiness in stomach, not ameliorated by eating. Empty sensation in stomach and abdomen without desire for food. Emptiness in stomach from 10 a.m. till evening. Emptiness in abdomen in the morning after the usual normal stool. Indigestion, faintness, constipation, confusion, sleepiness after eating. Pressing in the liver. Soreness, and enlarged liver. Fullness and rumbling in abdomen. Watery stools, involuntary while urinating. Stools pass unnoticed. Dark brown stools, with blood. Much flatus with stools. Urging aggravated by motion. Dysentery, putrid blood and slime. Hemorrhage from intestines of dark liquid blood. Prolapse sandy while urinating. Urging to stool while urinating. Marked relaxation and itching of anus. Large, dark, purple hemorrhoids, extremely sensitive to touch. Inflammation of the pile tumors, hot and pulsating, must lie with limbs wide apart. Bleeding piles. Burning and cutting during stool. Burning after stool, ameliorated by warm applications, aggravated from bathing with cool water. Excoriation of anus. Fissures. The urine flows in a feeble stream. Must wait a long time for urine to start, must press so that anus protrudes. This is in keeping with the general paralytic muscular weakness in the body. Involuntary flow of urine and stool in low fevers. Burning and cutting in the urethra while urinating, tenesmus follows. Impotency, desire weak. Bloody, watery discharge from the urethra. Scrotum bluish. Itching of the scrotum not ameliorated by scratching. Margin of prepuce sore. Pressing in genitals as if menses would appear. Menses too early and profuse. Ulcers on genitalia with putrid discharges. Cannot bear least touch, not even of sheet on genitals. Leukorrhea with backache. Puerperal fever with extreme prostration, dropped jaw, sliding down in bed, suppressed lochia. Stool and urine putrid and involuntary. Short breath with rattling after drinking. Breathing seems to come from stomach. Oppression of chest. Pulse slow and weak, intermits every third beat. Pressing pain in back. Pressing, drawing, tired feeling in small of back. Burning in spine. Heaviness of arms. Numbness and coldness of fingers at night. Lower limbs dusky. putrid ulcers on legs, with burning margins, swelling of right tendo-achillis, feet cold and blue, burning of palms and soles, swelling and burning of tips of toes, tearing in limbs, ameliorated by motion, pain in the limbs, during intermittent fever, evening fever with chill with or without sweat, chill mingled with fever. The image of this remedy is found in typhoid and yellow fever. Perspiration during first sleep, symptoms worse when perspiring. Thanks for watching this video. If you want more videos like Muriaticum acidum, please subscribe to this channel and press the bell icon. To learn homeopathy course online free with Homeopathy Materia Medica. Comment us your feedback and what you want in the next video. Like and share this video with your friends and family. For paid and free consultancy online, visit homeopathymedicines.com and mashclinic.com. Thank you. Have a nice day. Stay healthy, stay happy.